Good afternoon. My name is Chrissy Matheson, and I'll be your moderator for today's press briefing. Before we begin, I'd like to introduce the Premier of Nova Scotia, Stephen McNeil, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Go ahead, Premier.
Thank you, Chrissy, and good afternoon, everyone. There are 5 cases of COVID-19 being reported in the Central Zone today. 3 of these cases are under investigation. 2 cases are connected to previously reported exposures, including one at Auburn High School, which was announced last night. We closed Auburn Drive family of schools today for a deep clean, and I want to thank our operations team and our custodial staff for their quick response and their hard work to keep our schools safe. We now have 2 cases of COVID in Auburn Drive High School and 1 case reported earlier this week in Graham Creighton Junior High. Public Health has established close contacts in each of these cases and continue to do testing. So far, all but 1 have come back negative, and we continue to do the deep clean. We are working hard with Public Health to make sure that we follow the proper protocols. But because we have 2 cases in these 2 schools, we have decided effective immediately, Auburn Drive High School and Graham Creighton Junior High will close for 2 weeks until December 7th. At-home learning will take place. The school gymnasium and the sports programs will also be closed for the next 14 days. We are doing this as a precautionary measure, but the reality is we have COVID in these 2 schools and in the surrounding communities. Today we are also announcing strict measures in most parts of Central Zone. Effective Monday, for the next 4 weeks, we are reducing gathering limits, not just at our home, but also in organized events and social gatherings. And Dr. Strang will give you more details on this in a moment. We have started to reduce our contacts and keeping our distance. But let's call this what it is. We are having a problem with 18 to 35-year-olds. They are going out when they are feeling sick. They are going out in large groups, and quite frankly, different groups, and are not distancing. They are living as if COVID doesn't exist. Our restaurants and bars want to stay open, but they agree we need to put in place some new measures to protect Nova Scotians and their employees. Effective Monday, if you go to a restaurant anywhere in this province, you will have to provide your name and phone number for contact tracing. And effective Monday in Central Zone, you will not be able to sit at a table with more than 5 people. The employees are there to serve you, not police you. When you break the protocols, you are putting them at risk, and quite frankly, that's not fair to them or to their families. We're worried about this group, so starting early next week, we'll be conducting an asymptomatic testing strategy over a 7-day period for all bar staff in Halifax. We are also putting in place a number of measures around long-term care to protect our most vulnerable. And Dr. Strang will provide specific details in a moment. But before that, let me just add, we're at a critical point in our province. If we don't act now, it may be too late. That's why we're taking a targeted approach in the Central Zone to contain this virus here and slow the spread. Dr. Strang.
Thank you, Premier. Good afternoon, everybody. Our last briefing was on Tuesday, the 17th. Since then, we've announced 9 new cases of COVID-19, including the 5 that we are reporting today. As the Premier said, 2 of today's new cases are connected to previously announced cases, and that includes the school-based case that was announced last night. 3 of the cases, however, are still under investigation, but preliminary information suggests that they have local community spread. So what we said on Tuesday that we're beginning to see community spread, we are seeing community spread, and it continues to increase. And we all need to pay attention to that. Yesterday we had 1 person in hospital, but I'm pleased to report that there are currently no hospitalizations due to COVID-19. The lab continues to be busy. They completed 1,384 tests yesterday. And so far in November, we are now up to 51 new cases of COVID-19. With the third case in one family of schools, the province is moving to Graham Creighton Junior High and Auburn Drive High School to full online learning for 2 weeks. The hope is that these schools can reopen on December 7th. This step reflects what is evolving in broader HRM, the significant level of concern among parents and teachers, and has been done out of an abundance of caution. So let me move to the broader community spread. While travel sparked our initial cases a few weeks ago, it is now social activity that's fanning the flames and causing the virus to circulate more widely. As I said earlier this week, we're at the beginning of community spread, and it is now here and is rapidly becoming widespread. This is extremely concerning place to be, and it should concern all of us, every Nova Scotian. I'm worried about the potential for this situation to snowball to the point where we will overwhelm public health, our healthcare system, and our ability to control COVID-19. Just look around in other provinces in this country and see that where they are at. So we are at the point where this could easily we could easily go down that path as well. So we need to all do what we can do, and we as government are putting targeted measures in place to try to slow the spread and bring COVID-19 back under control. I know that we've had 3 cases in schools, and that has people worried. But the school setting is not what's driving the spread of COVID. Sports, arts, and other community activities are not driving the spread of COVID-19. Workers who come into the province are not driving the spread. The main driver of transmission is our own social interactions. We're seeing spread primarily among young adults getting together to socialize in their homes and out in public businesses. When I say that, I want to be clear, we're not blaming anybody. Most bars and restaurants, among other businesses, are providing safe environments for patrons and staff, as long as everybody follows all the public health protocols. They are following the rules to allow Nova Scotians to get out with friends and family and still be safe. It's through their hard work and the cooperation of Nova Scotians that following the public health measures that we've had the luxury of living in the safest place in North America for the past few months. Our Atlantic bubble has been the envy of the rest of Canada and our neighbors to the south, and we've been able to live mostly normally. But we're not impenetrable. The virus has gotten in through travel, and now it's spreading through social activities. When I talk about locations like bars, restaurants, or when you see notifications about other places through public health notifications of potential community exposure, we're not labeling those locations and the businesses. What we're doing is we have to name them that they purely are the settings where we're seeing the social activity that is allowing the virus to spread. So we have to take these new precautions in these various settings where the virus is finding the opportunity to be transmitted from person to person. We need to protect frontline staff in these locations and their patrons. So when we say we're taking stronger action, it doesn't mean we're shutting everything down. We know that shutting down the whole province would come with many personal and economic costs, and we do not want to have to do that again unless absolutely necessary. So that is why we're taking the early action and a targeted approach to slow the virus's spread down, to have it at a level where we can maintain our ability to control the virus. It's important that all Nova Scotians understand that we need everybody to be vigilant. But we are focusing in the area where we are seeing the local transmission. So we're focusing on urban and suburban areas of Halifax Regional Municipality. And we're also focusing on the necessary actions to decrease social activities and social group numbers. It's very important for all Nova Scotians to keep their social circles small and consistent, but in urban and suburban areas of Halifax, we are putting restrictions in place to ensure that that happens. So the geographic area we're targeting is the western half of HRM, from the municipality's borders with Lunenburg County to the west, and as far east as Porters Lake, up to Hants County to the north, including Mount Uniacke and Enfield, parts of which are in west and east Hants County. It does not include the eastern shore from Porters Lake to Ecum-Secum. So this geographic area is based on existing community health areas, and they most closely reflect areas where cases are happening. We will have a map outlining all this on our coronavirus website so people can see it visually. So all the gathering limit changes I'm about to outline are for the communities within this big section of Halifax Municipality. All of them come into effect 1 minute after midnight, Monday, November 23rd. If all goes well, we hope to end them on Monday, December 21st. That is 28 days or 2 incubation periods. Since the spring, people have been allowed to have close social groups of 10 without physical distancing. Starting Monday, we are reducing that to 5 in the relevant areas of Halifax Regional Municipality. That means you can have 5 people come to visit you in your home at a time, up to 5, regardless of how many people live in your household. However, when people go out into the community, they can only go in groups of up to 5. And that allow within that 5 that don't have to maintain physical distancing. That means that bars and restaurants can have tables of no more than 5 people sitting together. In these areas of HRM, we are lowering the general gathering limit from 50 to 25. This limit is for gatherings that are not hosted by recognized businesses or organizations. These are informal community gatherings such as neighborhood street parties. If the event is hosted by a recognized business or organization, the limits are larger overall, but these are also being lowered in the relevant parts of HRM. So outdoor events can have 150 people down from 250, and indoor events can have 50% of a venue's capacity to a maximum of 100 down from 200. An example would be a wedding reception in a hotel ballroom where the hotel or a wedding planner organizes the event, or the hockey games that we're having at Scotiabank Arena. Whether you host the event yourself or it's hosted by a recognized business or organization, gatherings will still require physical distancing, except among people from the same household or a close social group of now 5, not 10. So let me reiterate that these changes are just for the section of HRM that I outlined. For the time being, there is no change to the limits in the rest of the province. However, that could change if cases continue to rise, and we will not hesitate to do so if needed. We are not putting a limit on class size in schools. We're not lowering the number of children who are allowed in groups in daycares, day camps, or before or after school programs. They remain at 15. We are not lowering the limit of 50 for sports or performance arts. That is simply because that is not where we're seeing disease transmission. As I said, we are focused on social events and social numbers that are driving transmission. We get lots of questions about that, but we're trying to be targeted. However, if we need to go broader, make no mistake, we will do that, and we will not be slow in doing that if it's necessary. People need to understand we're announcing things today. Our approach may well change in the week or days to come if we don't see things in the trajectory of changing, and that change. We may broaden it geographically. We may stay within the same geographic area but add on additional tightening of restrictions. All will be driven by as the epidemiology evolves. There's an additional change related to long-term care that applies just to the area of HRM that I outlined, and that is community-based adult day programs for seniors can no longer be offered starting Monday, November 23rd, and we hope we can bring them back as of December 21st. That is simply as we have increased community spread in HRM, bringing together very vulnerable individuals, seniors, in day programs, it creates significant potential risk for very vulnerable people. So we ask all the organizations that are doing that. There are long-term care facilities that do this. There are community groups, churches, et cetera, that do this. It's still important that seniors can connect, but maybe it needs to be one-on-one visiting, or maybe it's doing it virtually. But bringing groups of seniors together in the community in HRM is no longer is too risky for us to allow that at this time. The day programs for adults with mental and physical disabilities can continue, and that's simply a reflection of those individuals don't typically have the same underlying health risks related to COVID that seniors would have. Across the province, we also are announcing some new long-term care restrictions that, again, take in effect on Monday, and again, these are province-wide. Long-term care residents will no longer be able to leave their facility for visits into the community. We appreciate that this is challenging for residents and their families, but we are doing this to protect them from the virus as our case numbers rise. Facilities can, however, continue to take residents for drives in vehicles. Some facilities have vans, and also designated caregivers can take a resident for a drive in their own personal vehicle, as long as that designated caregiver wears a mask and has nobody else in the car. And whether it's a bus or an individual personal vehicle, it's a drive only, no stopping, no drive-throughs. It's just simply an opportunity to get the residents from the long-term care facility some ability to get out and at least enjoy the beauty of Nova Scotia from behind a window. I want it to be clear that these restrictions should not be seen as a signal, however, to long-term care facilities that they need to clamp down on other things that we have allowed progressively over the last few months that allow visitation and very important social interaction, people coming into the long-term care facilities. We know that visits with family and social interaction is critical for the well-being of residents, and we need to let that happen as long as we possibly can. And that's why facilities must support other opportunities that are allowed under the long-term care directive for their residents, such as visiting and social gatherings in the facility. It's unfortunate, but I'm hearing too many stories of long-term care facilities that are not adopting the recommended public health actions. So we are telling facilities that you need to look after the care of the residents, not just their physical health, but their mental health as well. When we have recommendations that we feel apply an appropriate level of COVID safety, but still allow that necessary social interaction, and it's not okay to put barriers to that happening. Another change that we're making province-wide is requiring licensed establishments to collect names, contact information, and the date of visit for every patron who dines in the establishment. This is not required at fast food restaurants. That wouldn't be feasible, but it is where for establishments where patrons, what the restaurant sector calls full service establishments. Patrons sit, they order a meal, and it's served to them. This is for contact tracing purposes. So the only details that will be collected are what I identified: time, date, contact name, and contact information. If it's a party, it's one person in the party who's responsible then for contacting other people if necessary. So nothing more is required, and then we're cognizant of people's concerns about privacy, so we're taking the minimum necessary information. The establishments will keep this information for 4 weeks from the date that they collected it, and they will only use that information if they are asked to share it by public health. This is all about if we need to do contact tracing in a restaurant, that we have a registry of who was there at a specific time and date. Having these registries facilitate effective and timely public health action. I've been in discussions with the Restaurant Association of Nova Scotia and Restaurants Canada. They have already made this change voluntarily in their sector plan, but at their request, we are making this mandatory, and I thank them for their support for this measure. As the Premier had said, while we're not targeting bars and restaurants, we are working to support them to make sure that we are able to apply testing for their staff, acknowledging that their staff are working in a higher risk environment. And this is part of our targeted approach simply because of that higher risk and the potential for spread within those environments to and from bar staff. It's a recognition of the critical role that these establishments and the settings that facilitate social interaction play. So as the Premier had said, this testing is voluntary. The staff do not have to do this, but it will start with current staff of licensed establishments in downtown Halifax. And this is establishments that are stay open late. Their license allows them usually to stay open until 2 o'clock, and that is going to be our focus. We're working with the sector to identify the specific establishments, and starting on Monday, we are going to be providing them information, and they've agreed they will help communicate that to all their staff. And we're going to start with the downtown area because that's where we're seeing the most problems right now, and we certainly will expand that if it's necessary. It's simply another tool in trying to prevent our community spread from snowballing into something bigger. In the meantime, as for any bar staff who are listening, that like every Nova Scotian, we're saying that if they become unwell, they should stay home or go home and do the online self-assessment and follow directions for testing through that. The last item I want to talk about is some clarification about last week's change for self-isolation after travel. We are strongly discouraging travel in and out of the Atlantic bubble at this time. We are in a very vulnerable position. Our case numbers are lower than other jurisdictions, but if we're not careful, we could find ourselves overwhelmed, as I said previously. So limiting travel, it remains a key way to continuing to protect each other. However, and when people do come in, the quarantining is important. But we do recognize that there are some situations where travel remains necessary. And those are people who have to travel for work. They may not, where they cannot do the work virtually. We've had a number of communications into government over the last week in various situations where people still have to work. They don't meet the definition of a rotational worker, but their work requires them periodic travel in and out of the Atlantic bubble. We also have legal custody arrangements that require parents or children to travel. Sometimes there's specialized health care that is not available in Atlantic Canada that people have to travel to. And occasionally there is essential legal proceedings outside of Atlantic Canada where Nova Scotians may be required to travel and virtual attendance isn't possible. And we also have the number of students who study outside of Atlantic Canada, even though their primary or family residence remains in Nova Scotia, many of them looking to come home to reconnect with family for their own personal mental health over the holidays. In all these cases, what we're calling necessary travel, that it still requires the traveler to quarantine, but we have a very specific protocol, and all the details will be on our coronavirus website. That if that strict protocol can be followed, and the protocol is all about making sure that the traveler quarantining doesn't come into close contact with anybody else in the house. If all those protocols can be followed, then the household members will not have to undergo the 14-day quarantine themselves. Unfortunately, when the traveler is a child who is too young to self-isolate alone, then that does mean that the entire household will have to self-isolate. Travel for any reason other than what I've described is considered unnecessary. And so if people choose to travel, what we call unnecessary travel, when it's not absolutely required that they have to do that travel, they have to understand that if they make that trip, then they will face a 14-day quarantine for the full household will remain in effect. And we are working on, as you talked about, rotational workers and how we manage that. We're in direct conversation with the other Atlantic provinces around how we have a consistent approach moving forward on rotational workers, even as the situation related to rotational workers and the risk evolves quite rapidly. So I want to end by emphasizing again that the need to keep our social circles small and limit our social activities. The more people we interact with in close contact, the greater the risk we're putting each other. So we want to make sure that, again, limit our social activities, keep our social circles small. Ideally, we'd have one single consistent social circle. In HRM, no more than 5, the rest of the province 10. If you can't have one, certainly we're asking you to limit the number that you have and keep that consistent. Also, avoiding crowds, even when shopping, wearing a mask, and staying home if you're unwell remain critically important. As I said on Tuesday, we are all COVID guards for each other. All 980,000 of us have the duty to protect the rest of us. Together we have the opportunity to change the trajectory and not end up like other provinces in the country. We're at a very vulnerable place right now, but our actions together will make the difference to turn the tide. Premier.
Thank you, Dr. Strang. Chrissy, over to you.
One question, one follow-up for the amount of time that we have allotted for today. First question will go to Andrew Rankin with the Chronicle Herald.
I just wanted to ask you, last week you said that there's going to be a plan in place to deal with the housing crisis in HRN. Is that coming this week? And are you going to reinstate the moratorium on evictions while the emergency is still, the state of emergency is still in place?
Minister Porter will have more to say on that next week.
Go ahead with your follow-up, Andrew.
So I'm wondering what's going on with the rapid testing. Is that online yet? And are you going to get up to the expected 2,500 tests?
So the 2,500 test is using PCR swabs and then running that 2,500 tests a day in our labs. We are at that place now. We have that capacity, and that's been built through, putting things online, from self-assessment, booking appointments, expanding capacity in our PACs. We have looked at the logistics and the issues around the rapid tests, and they're not as rapid as you think. They still require somebody to be a swabber to take a swab. That they have less reliability than the PCR tests, so they do have some significant limitations to them. So where we're going to be using these is in the places where we may have large outbreaks, where we need to get testing done, even though we can tolerate less reliability in the tests.
Next question will go to Elizabeth Chu with CBC.
In regards to bars and restaurants, Dr. Strang, are you giving any thought to upping the enforcement, since it's social activities that seem to be the problem area, upping enforcement by provincial workers?
So we already have a strong enforcement. Alcohol and gaming is in our bars and in the evenings on a regular basis. We're working. Our enforcement folks are working and developing a plan over the next few weeks. And it's alcohol and gaming, the restaurant inspectors, food safety, and our labor, occupational health and safety folks. We're already doing, bringing them. Developing that plan. We have already used them in the last couple of weeks when we've had specific establishments. One of the first things we do is have an inspector go in there. I asked for, a sense from the inspectors of what they were seeing, and that helped inform my conversation 2 days ago with the restaurant or the bar sector. So there already is a strong enforcement piece, and we will continue to have a strong role for our inspectors on the ground at the right time. It's not during the day. It's late at night, Friday, Saturday, Sunday, Thursday, Friday, Saturday. So we have that already.
PEI and New Brunswick, they are discouraging non-essential travel even within the Atlantic bubble. Is that something that you're also considering?
So I think we've been saying that. We've said, when we had the situation a few weeks ago in northern New Brunswick, don't travel there. But our basic message to Nova Scotians is to stay close to home. Every time we go out, the further we travel, the more interaction we may have with people. The next month, and this is going to be a very different, holiday season. Stay close to home. Enjoy family and friends in small numbers, close to home.
Next question will go to Lindsay Armstrong with All Nova Scotia.
Thank you, Dr. Strang. I'm hoping you can explain the planning behind the school closures you've announced today. This seems to go against the CDC recommendations, which came out recently, which recommend closing schools for contact tracing and decontamination for just a few days, because the CDC's modeling indicates that short to medium closures of a couple to several weeks do not actually impact COVID-19's epidemiological curve. So I'm curious about the planning there.
So the 2 weeks comes from we need to understand 2 weeks is one incubation period. So anybody who was the close contacts we've identified, they need to be home for 2 weeks. We felt justified closing the school. It's not just for public health reasons, as I said. We need to take some actions in the school, but it's also a recognition of where we're at in HRM and where we may be in the days ahead with other schools. That we can't rule out that the schools are a reflection of what's going on in our communities. And it's also recognizing that this is the first case in schools we've had. There's a significant amount of concern and anxiety in parents and teachers around these schools. We had a very high absenteeism rate last week, I've been told by education, in these schools. So there's a lot of concern. So out of putting all that together, we felt the appropriate approach is to both the high school and the junior high. We have robust plans for, and education can speak more to this, but robust plans for those students to learn from home so they can continue to learn while we take this break and do what's necessary in the school, observe the epidemiology, but also we can observe the epidemiology from the broader community as well, and where we might have to go further in terms of restrictions in a range of areas that may or may not include other schools.
I'd like to dig into that a little bit further, understanding that you said just earlier that the schools are not driving the spread of COVID themselves, and that these recommendations really say that those several week closures, or these couple week closures, aren't actually affecting the curve in the community. So where does that transfer into the community spread?
So we fully recognize closing the schools is not about affecting community spread. Closing the schools is making sure that we can do what's necessary to ensure that the schools remain safe, to make sure that parents and teachers have the confidence that the schools remain safe. But in terms of community spread, that what we do in schools is simply, what happens in schools is simply a reflection of community spread. And I've been saying that for months, that the way we keep our schools safe is have our community safe. And that's why we need everybody. One of the reasons we need everybody to, it's that COVID guard concept. All of us taking action is what's necessary to keep our schools safe. All of us taking action is what is necessary to make sure we don't overwhelm our healthcare system and keep our healthcare workers safe.
The epidemiology will drive the decisions we make around containing the virus. In the school community, there's other aspects of health that we have to consider and the Department of Education has to consider, which is the mental health of these students and the community. This is an acknowledgement of the stress that families and communities are going through and allowing us to find our way collectively as we deal with the virus and try to get back to some level of normal education. The department, through the minister and the deputy, have been working very hard since September to look at virtual learning. We will continue to have a level of learning, but I want to reassure parents, even those that are not in the school community, that we are very concerned. We have in place plans that we will enact. It won't mean that your kids will not get an education. We will find ways to provide that education, but their health and safety, not only through the virus, but quite frankly, the stress that they've been feeling. We've heard loud and clear, as Dr. Strang just said, there were a lot of parents who were exercising their right to keep their children home because of the stress of what was happening. We're going to go into those schools, do a deep dive as we have, but we're also just asking those families to take an opportunity to reassure their children that the learning environment will be safe, that the people who are in control of that environment care about them and want to make sure that they're safe, and that we will work with their teachers over the next number of weeks to make sure that we stay in contact and connected to them.
Next question will go to Graham Benjamin with Global.
Yeah, just going off my colleague's question there on the school closures, just feels like a bit of a change in tone, just because on the Tuesday briefing, you said we were nowhere near closing schools, and then 48 hours later, there's one case. The next day, the school's closed for 2 weeks. So I'm just wondering how it got to a point now where, 48 hours later, there's one case, and then it's closed for 2 weeks.
I think very much, as I just said a few minutes ago, there's more to the situation than just dealing with the epidemiology around the virus. It is also about the anxiety that was being felt in that community by families who have made the decision that they were keeping their kids home, which they have every right to do. We want them to take these 2 weeks as we do the deep dive again on these schools, but we want to work with them and their educators to reassure their children that as they re-enter back into the school system, we will have done everything we can to deal with the potential virus, but also that we care about other aspects of their health and their education. As I said to you, we went back at the beginning of this, back in March, when we shut our school system down completely. We worked very hard, the minister and his department, over the summer leading into September, of what would happen if we had to make changes to our school year. How would we continue to provide the education? We have the ability to do that by working with our teachers, with technology. And this is also a chance, as I said earlier, for all of us to reassure kids no matter where they live. We have kids in, I'm sure there are kids all over the province who have seen what's happened in a particular school that are feeling a level of anxiety. They need to be reassured that we will do everything we can to protect them and respond to the circumstances that are happening in their particular school community.
Go ahead with your follow-up, Graham.
Yeah, so with this happening at Auburn High and Grand Creighton, is there any potential for moving to more of a hybrid learning model where you have not students in classes all the time, but kind of at a 50% capacity? Is that in consideration right now?
So if you look at what the department has, a couple of models that they would use, which would potentially be currently all online, or you would have a hybrid model where we would reduce the number of people in our schools, particularly at the high school level, and then we would spread out the remaining student population in a broader space, so that would reduce their kind of contacts. But the part of what we're doing today is we're not there yet. Many of our school communities are functioning. It's why it's so critical. And whether it's dealing with this virus, we are at a critical moment. It's why it's important for people to follow the advice of public health protocols, whether you're in this catchment area or not, across the province. Continue to follow the advice of public health. But reassure your children that as they're learning, we are watching that school environment, and if we have to respond quickly for their health, we will. And that's just not related to the virus. That's also to deal with mental health, other issues associated with anxiety that are all part of this. And that was the reason that decision was made today. But if we have a broader issue inside of our community like we did last March, the Department of Education has a number of models that they would enact with our education partners and teachers across the province.
Next question will go to Tim Biscay with the Halifax Examiner.
Yeah, hi. I'd like to return to the testing question. I understand you to say that you've actually reached the capacity to 2,500 tests a day, but the numbers of tests that we're seeing processed are around 1,300. So I point that out because we've gotten, I don't know, a dozen advisories, and the advisories tell people if they were there to monitor for symptoms. First of all, it doesn't say self-isolate. And we know that the spread is happening asymptomatically. So why not just test everyone who is at the places that are being sent out for advisories?
The reality is that the reason where it's just an advisory to monitor symptoms, public health does a judgment. Those are low-risk environments. Most of those are stores, retail environments where there isn't prolonged close interaction amongst people. So when we judge it's a low-risk environment, the appropriate intervention is to warn people, just to continue to emphasize that they need to really closely monitor their health. If using testing broadly, people, asymptomatic people in that state, we're going to get is not a good utility of our testing capacity. We are focused, as I said, we're focusing on symptomatic people as a first priority. We are starting to bring online, the bar testing that's going to start next week is a good example. When we see a specific population that has a higher risk, then we're going to bring them in and use the testing. As much as possible, we're going to use PCR testing because it's much more reliable in terms of the validity of the results. But we also will use the point of care testing if it makes sense, in addition to the PCR testing. So, and we have a number of others, as I said, we're working on very soon. We're looking at how we use testing potentially for rotational workers, long distance truck drivers. We're looking at how we do that very soon. So we have a number of focuses that we have to keep capacity for, and we're working on those. But at the same time, we also have to make sure we maintain some surge capacity in our testing. We are going to see more and more people with symptoms coming forward that need testing, and we've got to make sure that they're a priority to make sure they have timely access to testing and results.
Related, I think. I mean, there was the case of the bar where there was transmission at the bar and an advisory had been sent out. And I asked you last week about that, and you didn't answer. So I'll ask the same question about the schools. Can we get some sort of details about how transmission, or if it happened at school? Did it happen on a school bus? Was it, the kid the next desk over? Can you give us some sort of idea about what happened? How did people associated with those schools contracted the
There's two
disease?
things there. We don't know for sure. What we do is have a person who's a case, that we go their history, where they were likely exposed, but then we also say all the people that they were in close contact with. And our definition of close contact is everybody in the classroom, because we don't know for sure that just because they were one end of the classroom or another that he couldn't have had the contact. But there's a lot, you're asking for us to be definitive in areas where we actually cannot be definitive. At the end of the day, for every case, in most of them, the best we can say is they lived in the same household together. How they exactly got transmitted, we don't know. They were in the same classroom together. So it's all about what is the risk of transmission. The other piece here, we've already had it. When we start identifying even in the same classroom or on the same bus, we've already had people online. The cases we have right now are being harassed by people on social media. I am very protective of these people, Tim, and I'm not going to put them into a situation where we put an increased likelihood they're going to be harassed simply because you're asking for information. We have to protect their privacy as an important tenet. At public health, we get people's private health information. I have a legal responsibility to protect that privacy.
Next question will go to the Canadian Press. Keith Doucette.
Yes, Dr. Strang, I'm wondering about the measures in HRM and why you wouldn't extend it to the entirety of HRM. And why I'm saying that is because we're entering the holiday period, and I'm just wondering whether there's increased risk in any event, and perhaps we need to get people in the mindset that they have to be more mindful of what they should be doing, because it seems to me that there could be a problem ahead that we're facing here.
So, but where we're seeing, we're trying to be as targeted and as focused as we can, and what we're seeing is in the areas of HRM, which really are those urban, suburban areas. We're not seeing disease in people who are out in, as I said, Porters Lake and East. But everything we're putting in place, social gatherings of 5. So if you, say, let's say you have a restaurant, now you can only have tables of 5. And if it doesn't matter, if you come from Truro, New Glasgow, Yarmouth, Middle Muscadaba, if you come in to HRM, you have to follow the rules that are now in place around social gatherings, et cetera, for HRM.
Go ahead with your follow-up, Keith.
On the same theme, I'm wondering, in regards to the most recent surge over the last month or so, has that been connected in any way to activities centered around Thanksgiving? And again, does it give you pause, perhaps, about the Christmas season? Because it's coming, and it seems to me that that's a potential problem here as we deal with the current outbreak.
If you look at the epidemiology of it's Thanksgiving is a bit too distant to explain how we're getting this surge now. We're not, but as I've said, a number of our cases now we're not sure where they got exposed, so we're not sure where ultimately their exposure was. But I believe we probably had wider spread over the last 2 to 3 weeks, so which is a bit removed from Thanksgiving. I am certainly concerned about Christmas, a time of the year or the holiday season when traditionally we have lots of people crowding in shopping malls. We have lots of gatherings, parties, families getting together, businesses, etc. That we're trying to get out of. That's one of the reasons we're starting now with tighter restrictions. And as we said, hopefully we get things under control and then we can start to ease off closer to Christmas. But make no mistake, even if we are in a position to be a little bit less restrictive as we get right close to Christmas, Christmas this year people need to get this in their heads now. Christmas or any other festive part of the holiday season has to be different this year. Starting with travel. Don't be bringing people in or don't be looking to travel widely over the holiday season. If you're planning events, whether it's a work event or a family event, small numbers. Limit the numbers you're going to. We have to get through the holiday season by practicing COVID safety.
Next question will go to Natasha Pace with CTV. Natasha, are you there? We'll move on to Francois with Radio Canada.
Good afternoon. The Nova Scotia Teachers Union said that they learned through the media that there were cases in the classroom this week, and they said that the province wasn't proactive enough, in their view, in the way that they would have communicated that information with their staff. I'm just wondering, what do you have to respond to that?
This is obviously when those first cases came in. It's my understanding it was late in the day. We were trying to communicate with families. Whether the protocol dealing with the union was absolutely perfect, I'm not sure. I think all of us have to recognize, whether we're the Nova Scotia Teachers Union or any other aspect of our society, public health is under a tremendous amount of pressure to deal with this virus, which has caused tremendous amount of stress in all of our lives. Whether we communicate exactly at the moment in time where people feel they should, we're sorry if that hasn't worked out for them, but we're really trying to make sure that we communicate to those families most impacted, which would be those teachers, and we'll continue to do that. But I'll go back to my message. Let's all of us recognize we're in this together. Pointing fingers at this moment in time because you were 15 minutes late being notified really isn't helpful.
Go ahead with your follow-up, Francois.
I'm wondering about bigger shopping districts like Bayers Lake. There's been a lot of advisories that went out over the last few weeks about potential exposures in an area like Bayers Lake, where there's a lot of big box stores going into Christmas shopping season. Dr. Strang, you just touched on that a few seconds ago. Are there any particular measures that you have in mind that would enhance the safety of people doing shopping there for the next few weeks?
So there's two things we have in place already. We have most of our retail businesses have had months of doing a very good job of. They limit the numbers of. They have a requirement that they can only let the number of people in that into their establishment which that they could, and still have people physically distanced. So they're controlling their numbers. Most businesses have directional signs. They are facilitating hand washing. A number of businesses are already collecting guest registers. People to come, like we're announcing for the restaurants. So there's a number of things that many businesses are already doing a good job. The other piece of this, this is where we need Nova Scotians each to be responsible for their own activities. How much shopping do you need to do at any one day? When I look at some of the activities of some of our cases, I'm not that busy, and I'm a lot older, but I'm not that busy in a month compared to how some of these people are around in a day. So everybody needs to think about, how much do I really need to go out? How many places do I need to go to? We all have a responsibility, and even if I go somewhere, if it's crowded already, maybe now's not the time for me to add to that crowd. We can't make businesses solely responsible for this. If we need to, there are things we're looking at that if we need to, that would further reduce crowds. We're not there yet. But I have to come back, the vast majority of businesses have been doing a really good job for a number of months. We need every Nova Scotian also to follow the rules. The other piece is about masking. Too many stories of people, finding reasons to not wear a mask or not wearing a mask properly. That's another protection. Shopping's okay, but be thoughtful about how much you shop, what actions you take when you're shopping.
Next question will go to CTV's Natasha Pace.
Thank you. Sorry about that. I hit the wrong button. Dr. Strang, since you started giving these briefings earlier this year in March, you mentioned the entire time you were very concerned about community spread. You really wanted to avoid there being any community spread in Nova Scotia. And now that it's here, I'm just wondering if you can give us any idea of how bad community spread is at this time. I know you put the restrictions in place for certain areas of the province. So can you just elaborate on that a bit at this point? How bad is the situation right now?
Well, we have a handful of cases. We're probably up to about 10 to 12, where we're saying we don't really know. We can't explain how they got exposed. So we have that number of cases that we're aware of. That quite likely the explanation is they were exposed here locally. We know when you look at other jurisdictions in the first wave that once you start to detect cases that are local spread, you probably had a couple of generations of transmission prior to that. So we quite likely have fairly widespread, still within, we have to say, within this 18 to 35-year-old population. We're not having cases popping up in younger or older ages. So how we get a control, but we're still early on. We're not, if you look at, Quebec and West, we are nowhere near where those other provinces are, and thank goodness we're not. But we're not going to just watch this and hope that it improves just by the measures we have in place. We will continue to, we are imposing more measures today, I think in the appropriately targeted geographic area. Make no mistake that if we need to go further, we will go further, whether it's stronger measures or broadening the geographic area. And we're not going to be slow in doing that either. So I'm very concerned about where we're at and the potential trajectory. But if we all do the right things, what we're all supposed to do, as well as the measures that I'm going to advise the Premier that we need to apply, we can set ourselves on a different trajectory over the next 2 to 4 weeks. And that my hope is that if we all do this together, we actually end up just before Christmas, not that we're going to be safe from COVID and we can completely relax, but perhaps we can say, oh, now we have COVID under control, we can have a little bit more social interaction, a little bit more ability to relax over the Christmas season. That's my hope. But the only way we get there is by really knuckling down now and doing what's necessary, and it will require sacrifices from everybody. But we make those sacrifices for each other.
One of the lessons that we've learned as we looked across the country, that when you begin to see community spread, you need to act quickly. And I commend Public Health and Dr. Strang for acting quickly. We do not want to end up in a position that we're seeing some of our sister provinces in across Canada. But I can tell you, us acting quickly and putting in these protocols will really, our success will depend on you. And the willingness of people to support these protocols. While our cases may be low, I just ask you to think about a month ago what was happening in some of our other sister provinces.
Go ahead with your follow-up, Natasha.
Thank you. I apologize if you answered this already, Dr. Strang, but I just wanted to be clear. The case connected to Auburn Drive High School that was announced last night and that is in today's numbers, is that, are you saying if that is in fact a student? I just wanted to be clear on that.
It's a person who attends the school. They're recognized as they're a close contact of one of the previous cases.
Next question will go to Daryl Coe with the Amherst News.
Hi, Mr. Premier. The question I have is regarding the border coming into Nova Scotia. I've been talking to some Amherst businesses, and they're saying that there's changes being made to the entrance to the province, that vehicles will no longer have access to La Plante Street getting into downtown Amherst. Is there anything that can be done to help those businesses out?
Well, obviously, we're looking to make sure that when people are coming to our province currently that we get an opportunity to see the cars that are outside the Atlantic bubble. We'll continue to monitor that. You will see coming into the province, I believe today, there may be ongoing right now. Daryl, you would there may know better. I think there's a barrier going up between the two lanes, one where trucks will be able to go and those that are in the Atlantic bubble can go. And then there will be another lane where we'll stop that traffic. That barrier will remain in place. We will continue to assess how long we need our border people there, but we will leave that infrastructure that is currently in place right now there for the remaining number of months, really through the winter. Even if we take out the inspection at the border, we will leave that barrier in place just in case we need to reinstate it. Which means traffic will need to slow down as it starts crossing that border, in the coming days.
Go ahead with your follow-up, Daryl.
That answered your question, Daryl.
Is there anything that can be done to allow vehicles to get back onto La Plante Street? I know exit 1A is closed off, but during the summer there was a sort of a driveway that was used by motorists to get onto the road into downtown Amherst and business in Fort Lawrence. That's now going to be cut off. Is there anything that can be done to reconnect that link?
Well, it's really difficult if we're actually in the process of stopping vehicles that are outside of the Atlantic bubble. If something comes that we decide that border inspection is not required in the coming months, of course we would open up that street sooner rather than later. But that, as you know, exit 1A, which most of us didn't even know existed if we didn't live in the area, can be used to get around the inspection station where we are. So that's why that is in place right now. It's been that way now since March, when we put up our security. But I know that TIR and the minister are working with the local mayor on what are potential options.
Next question will go to Jean Laroche with CBC.
Good afternoon. Dr. Strang, the problems we had at Northwood were all about community spread and people in the community inadvertently bringing COVID into the facility to disastrous results. I want to hear from you what your rationale is for continuing to allow people into long-term care homes in the province, especially in Halifax, where we know there is now community spread. You've said so.
So, Jean, we have to understand that there's a number of protocols that are in place that people have to follow when they're coming in. Not just anybody can walk in. If you're a family visiting, you have to make an appointment. Everybody has to go through a health screening. There's hand washing. There's masking. So there's a number of, and we use this kind of layered approach that all these different layers provide quite a solid level of safety for people coming in. You also have to recognize that there are, and if you just look around the national media and a lot of people, gerontology specialists, etc., the substantive harm that has been done to seniors by the very tight lockdown during the first wave. People's dementia has substantially progressed. There are ongoing mental health issues. So we need to find a better balance between protecting people from COVID, but trying to allow them to have some of the essential social interaction that is so critical for whether it's their mental health or preventing people from irreversibly progressing dementia.
Go ahead with your follow-up, Jean.
Yes. Many of the recent warnings we have seen about possible exposure, Dr. Strang, have been in restaurants, bars, stores, and gyms. This is where those young people you talked about tend to congregate. Other provinces have restricted hours as a way to limit the spread. Why is that a good idea there but not here?
So that's not off the table. We're starting with the restrictions that we're announcing today. Limiting further limitations based on hours of operation, reducing the number of people that can come in at any given time. Those are all things that are on the table. That if we need to go to provide tighter controls, we will certainly do that. But we don't feel that we're trying to find a very focused, targeted approach. And then monitor things carefully, and we won't hesitate to go stronger. I certainly feel today is the appropriate approach, but if we have to, then, as I said, limit hours, further limit numbers, etc., we will go there.
Next question will go to Alicia Drouse with Global.
Thank you. I just want to ask about uptake on the COVID-19 alert app here in Canada and as well as in Nova Scotia. It doesn't seem to be generally a high uptake. In Nova Scotia, we know that from the NSHA that even those who do have the app, not all those who tested positive have actually entered their one-time key code into the app, so it alerts others. So I'm just wondering, how important is the app in terms of contact tracing, and do you have a message for people who aren't really using the app properly or not at all?
So my message is I would encourage anybody to have the app, and if you are unfortunate to test positive, upload it. It certainly is a helpful information. But I'm also, you've heard me say many times, it's just another tool in our big toolbox, and that certainly just the app itself is not going to solve everything. But certainly it's helpful and adds to the information. If people using the app get an alert that they might have been exposed to COVID, hopefully it will enhance their awareness and strengthen their resolve to practice COVID safety as well as to monitor their health very carefully.
Go ahead with your follow-up, Alicia.
This one's just about the exposures. I mean, obviously, over the last couple of weeks, we've had a number of locations that have been identified as possible exposures, and we do know that the bitter end resulted in a couple of positive cases. But I'm just wondering, aside from that, if any of the other exposure sites, are we actually seeing positive test results from these exposure sites?
So by and large, many of the people coming forward, we are close contacts that we're even places where we know there's close contacts, like some work sites. We're not seeing, by and large, them testing positive. When we go back to many of the cases, I'm not aware that we've had cases directly linked to some of these community exposure sites. Having said that, we have a number of cases now that we don't know where they've been exposed. They may have forgotten that they were one of these community sites, and that's not part of our information. So we can't rule that out. Having said that, a lot of times the community exposure sites still remain low risk because they are places where it's fairly transient interaction between people. And often, fortunately, we have many people in there are wearing masks, and all that is helpful to making them low risk for exposure.
Next question will go to Andrew Rankin with the Chronicle Herald.
You mentioned that you're concerned about the 18 to 34 age group and bars are a problem, but a couple of weeks ago, you allowed bars to remain open for an extra hour, serving alcohol in that time. And I'm wondering, in retrospect, is that a good idea? And also, what was the rationale behind extending opening hours for bars?
So it's simply we need to understand that there is, and when you use the words bars are the problem, I think that unfairly targets the operators. The bars themselves, like the vast majority of businesses, are doing a really good job of what they can do within the parameters to run their business. It's often the behaviors of people in the bars that aren't necessarily following the requirements is more of the challenge. When we looked at that, bars everybody's been struggling from a business perspective. Extending the hour what we did is extend them from midnight to another hour, from midnight to 1 o'clock, to allowing them another hour for food and beverage service. I don't think that adds a huge level of risk in. It helps them out from a business perspective. Having said that, as I just answered the previous question, whether it's bars or whatever, if one of the tools that we need to look at is rolling back hours, now that we're at a higher level of risk, that is something that is certainly on the table moving forward.
Go ahead with your follow-up, Andrew.
So what is the likely schedule for vaccinations in Nova Scotia if the vaccines start coming or being made available in the new year?
We have no certainty of getting vaccine. We have no certainty of timing. We have no certainty of amount. That's still all to be identified, and every province is in the same position. Where we're at now, we know the federal government has made procurement arrangements with a number of potential vaccine candidates. None of them are even licensed yet here in Canada. And there's no certainty about amount or delivery time. What we're working towards is having plans in place that if we do get vaccine, what we're being told by the federal government is be prepared to have to be able to vaccinate very small numbers of people as early as January. But by saying that, I'm not saying by any means there's any certainty, but be prepared. I think the one thing that we can make sure every Nova Scotian understands is that when we ultimately get vaccine, at least in the initial few months, we're going to get very small amounts of vaccine, and we're going to have to be very focused and targeted, and it will only be people who are judged to be at the greatest risk for COVID or severe outcomes from COVID, or healthcare workers provide care for them, that will get the vaccine. I think it's really important that Nova Scotians understand now is that just when we're talking about vaccine, it'll be months and months and months before we were able to get vaccine for everybody, if that even ultimately is the target to vaccinate everybody.
Next question will go to Elizabeth Chu at CBC.
Dr. Strang, in regards to the voluntary testing for asymptomatic bar and restaurant staff, how many staff are there, and what sort of uptake are you looking at?
So we're actually working. We're trying to get numbers from the bar. It's not every restaurant and bar. So there's a number. We've said they're basically a licensed establishment whose operation is based on late night service. That's what we're focusing on. And so we're working with Restaurants Canada and the Nova Scotia Restaurant Association to say what are the bars, and they're working to get us numbers. initial very, very, ballpark estimates are around 500-600 perhaps of staff, because there's many people work part-time, et cetera. It's voluntary. We're not going to force anybody to be tested, but hopefully we'll get a very high uptake take on this, because they are at increased risk. Hopefully they can understand that, and getting a single test. What we're doing now is just to try to get a sense of how much perhaps unrecognized activity might there be starting within this staff environment, because that will be a very good sense of what is the likely sense of broader unrecognized activity in kind of like this demographic. And because the staff have the highest risk because they're in there on an ongoing basis with multiple interactions with people.
So what would the impact be, do you expect, on capacity for testing?
So we're gonna be running this through and getting people in and to one of our primary assessment centers. So we're not sure on the capacity. We're basing it on we need to get firmer numbers of the numbers we're dealing with, and then it'll depend on what is the volume of people who actually come forward to be testing. We certainly are feeling that we given the many hundreds of people, but we're going to do it for a week. We feel we can certainly do this through the primary assessment center we have designated at the Halifax Infirmary. We feel we certainly have capacity to collect the specimens and run them through the lab.
Next question will go to Lindsay Armstrong with All Nova Scotia.
Regarding the vaccines being administered and rolled out, and I understand that we're in a very early stage and nothing is certain. You described the high-risk group who would be the top of the list for getting those vaccines. Can you say how those decisions would be made if we were to have a limited number and a large number of people who would be deemed high risk?
So there's been the National Advisory Committee on Immunization has done work, and they have presented their groupings of who should be targeted for highest priority for vaccination. That was presented and approved by the table that I sit at, the Special Advisory Committee. It's also been presented and approved by deputy ministers and ministers of health. That is available online, but those are big, large groups. So we're now in the process, and through the Special Advisory Committee, we've asked the National Advisory Committee on Immunization to drill down and be much more specific. And one of the things we're certainly pushing is that we need to be consistent across the country. That if you're identified as a highest risk and a priority for vaccination in Nova Scotia, that should be the same group by and large that is in New Brunswick and Ontario, et cetera. That national consistency is important, and so we're waiting to get more of that coming back. But I think, I guess the bottom line is there is a process that involves vaccine experts, public health experts, clinical experts from a national perspective. So this isn't just being pulling out of the hat. It's very evidence-based, and we're certainly focusing on a national consistency.
Go ahead with your follow-up, Lindsay.
Understanding that eventually a vaccine will be ready and we will need to administer it widely in the province, what is the province looking at in terms of administering a vaccine on a large scale? Would pharmacists be utilized, for example? Who will be the ones giving this out?
There's a range of options. A lot of it depends on the amount of vaccine we get. Also, the different vaccine products have very different storage and handling requirements. One of the vaccine products is ultra-frozen, meaning that you have to have, it's minus 70. No provinces and territories actually have those type of freezers. So the federal government is in the process of procuring those type of freezers, and so we're in the one per province. So we're in the queue to get one. But if it's that product, that's because of the limitations around the temperature, maintaining temperature, it has to be a very different model of delivery than some of the other products. So there's so many unknowns here that we cannot yet be definitive about who, where, how at this point in time. But you need to know that we are working as fast as we can to get as much planning that we can done, so when vaccine becomes available, we can move that forward very quickly.
And that's all the time we have for questions today.
Thank you, Tina. We have 28 active cases in our province. Compared to the rest of the country, that might not seem like much, but it doesn't take long for this virus to overtake an entire community. That's why we are wrapping our arms around greater Halifax area, where COVID is starting to take hold. People who live in these communities, and those of us actually who come into these communities that Dr. Strang has mentioned, we need to take this very seriously. To the 18 to 35-year-old, please consider not only your own health, but the health of those around you. You are our future. We need you to be healthy, but most of all, we need you to be leaders now. Those of you who live outside of those areas mentioned earlier, you are not off the hook. It won't take long for COVID to take a trip to the valley or cross the causeway in Cape Breton if we do not follow the public health protocols. There is a lot being said about our province and how well we are doing, and I'm really proud of that, and I'm really proud of all Nova Scotians. But let's not underestimate this virus. It has a vicious streak, and it's strong, and the moment we show weakness, it will take hold and creep into our communities. We have worked too hard to contain COVID. We have worked together, and we cannot stop now. I want you to have a good weekend. I want you to be safe. But most of all, I want you to be kind and think of others.